For those who've just joined, we've just started recording the session. So if you don't want your camera on, then please do turn it off. And if you have any issues with the recording, please let me know. So I'm going to get started. So as I said, today's session is on health, disability and unpaid care data that came up in the Census 2021. So just a brief overview on what the census is. For those who have been to these webinars before, you'll know this already, but some people are new, I know, so I'm just going to share a quick overview of what it is. It's a survey that happens every 10 years and it gives us a picture of all people and households in England and Wales. It helps organisations like ourselves make decisions on planning and funding public services, and that includes things like transport, education, healthcare. It gives us a population level understanding, but also enables us to compare to other places and to the national average. Quite a lot of the data can go in quite a lot of detail in quite granular areas and places, which is really useful for us in our work in Somerset. There's a really handy tool that they have started this year with the new census data, and it's called the Census Map. And in that map, you can kind of zoom in and explore different areas, and you can select which data you'd like to look at. I won't go through it in detail today, but you can find it on the ONS website, and there's a link to the website on these slides, which will be shared afterwards. Just a quick overview of what we've spoken about before. So at previous webinars, we did one on population statistics. So here in Somerset, we've got over 500,000 people, around a third live in South Somerset. A quarter of our population is 65 plus, so quite a lot of people come to Somerset to retire. It's a lot higher than the kind of average across England for that population. And we've got quite a mix of deprivation across the county. We also did a webinar on the labour market and travel to work. So around 60% of residents in Somerset are economically active. And so that means they're either in work or actively looking for work. Rural areas are more likely to host residents with higher socioeconomic jobs. And the very high proportion of Somerset residents drive to work compared to a lot of other regions in England. And a lot of that is related to our rural nature. And then finally, we looked at education and housing. So around 90,000 residents are in full-time education. 3 in 10 have level 4 qualification or above, while 17% have no qualifications. The highest with no qualifications is Sedgemoor. We also found quite a high proportion of people in Somerset own their own homes, and Somerset tends to have more bedrooms than required. So it's kind of a statistic looking at if there's enough space for the people that live in an area, and it kind of shows that Somerset's got kind of bigger houses and bigger households than you would expect. So today what we're going to talk about is health, disability and unpaid care. And the things that we're going to focus on that are in the census are health, so general health. So the question that they ask in the census is, how good is your health in general? For disability, we're looking at long-lasting health conditions or illnesses. So they ask questions such as, do you have any physical or mental health conditions or illnesses lasting or expected to last 12 months or more? And do any of your conditions or illnesses reduce your ability to carry out day-to-day activities? So it kind of looks at those disabilities that are limiting a lot for people, but also limiting a little for people. They kind of try and differentiate the two. And then unpaid care, that's looking at people who care and support for people with long-lasting health conditions or illnesses or problems related to old age. So just to note on the unpaid care point, that it's not looking at people who look after children, for example, for unpaid care. It is around people who have particular health conditions or problems related to old age. They are the two kind of factors for unpaid care. So we're going to touch on a lot of this data now and go into a bit more detail about what's going on in Somerset. And then at the end, I'm going to talk about how this all fits in with our work at SASP and our strategy. And there'll also be a chance for people to ask questions. If you do have any questions or comments throughout, please feel free to use the chat, and then we can have a discussion at the end. Just a quick brief note on methodology. So some of the data here today, they use age standardized proportions. So that allows for a comparison between populations over time and across geographies. And one of the reasons why they do that is that they compare it to the previous census. So it counts for differences in population size and age structure. So just wanted to make a note of that. More detail of that is on the ONS website. So health. In general health, around 50% report that they've got very good health. So what is important to note here is that a person's assessment of their general state of health was asked, and it was rated from very good to very bad. So it was up to the individual to rate themselves as to what they felt their general state of health was. It's not based on a person's health over any specified period of time. So it's not like you say over the last 7 days, how do you feel about your health? It was just generally, how do you feel about your health? It was a 5-point scale from very good all the way through to very bad. Something to note is that the census was conducted during COVID, and it may have influenced how some people perceive and rate their health, and may have affected how people chose to respond. In England, the proportion of people reporting very good health increased from 2011 to 2021, up to 47.5%, whereas there were decreases in the proportion of people reporting good health and bad health and very bad health. Note that there are very few people that report having said bad or very bad health. And it might be kind of related to the self-reporting aspect of this question. Some people might not feel that they would perceive themselves to have very bad health or bad health, and would shy away from selecting that as an option. When we look in a bit more detail in different areas of Somerset, we can look at the top 5 areas that have selected the highest rates of very good health, and those that have selected the lowest rates. So Burnham-on-Sea had the fewest amount of people who said that they had very good health, with only 35% of people. And Minehead, Watchet, an area of Taunton, and another area of Minehead all were in that the bottom 5 that reported very good health. Whereas those areas that had the highest reporting of very good health had over 50%. So Ilchester, Sparkford and Mudford had up to 55% of residents saying that they had very good health. I think what's interesting here is where these areas are and what types of areas these are. So what's interesting around Burnham-on-Sea, Watchet, Minehead, they're kind of rural communities, but they're coastal communities. So thinking about what aspect that has on people's health. And the bottom ones are a lot more kind of rural, affluent areas. Taunton is kind of the exception, is kind of more of an urban hub there, but places like Pilton and Bruton, they're kind of rural, small towns or villages. And then good health. So I think what's interesting here is that good health was reported at higher rates for those like Burnham-on-Sea and Minehead than those such as Bruton and Pilton. And you kind of see that again for fair health as well. And so what you see is that despite the fact that the places like Burnham and Minehead had the lowest rates of very good health, people aren't self-proclaiming they've got bad health or very bad health. They're not moving all the way down to the bottom. They're kind of shifting to good health and fair health. And that might be related to a self-reporting aspect of it, or it might be that's just kind of how they perceive their health. It's not really bad, it's just not very good either. I thought it'd be interesting to zoom in on a particular area. So this is an image from a custom area map. Another tool that the census has at the moment is that you can go online and you can select an area. So you can search for an area, you can search for a postcode, or you can predefine the area yourself. You can draw the area yourself, area of interest, and then you can select what data you'd like to look at and compare for that area. So I've focused on Burnham-on-Sea here because it came up as one of the lowest health outcomes. And as you can see here on the right, general health, the black line shows what the average is for England. So very good health for Burnham-on-Sea is around 38.3%, and it's 48.5% in England. So it's quite significantly lower than the England average. But as I just mentioned, it's because people are more reporting good health and fair health rather than moving all the way down to bad health and very bad health. So it's not that people are claiming that they've got really bad health. That kind of difference is distributed more between good health and fair health. Another interesting thing to think about is how that links in with other data for that area. And I'll just quickly look at that. So what could be going on in that area that leads to some of these health outcomes? So it could be related to economic activity status. So if you're economically active, you're either in a job or you're unemployed but actively seeking work. So what we see in Burnham-on-Sea is there's quite a high proportion of people who are economically inactive. And so people who are economically inactive, it doesn't necessarily mean that they are long-term unemployed. They could be a student, they could be looking after family, they could be long-term sick, they could be retired. So there's a real mix of people in that group, and it's thinking about what's going on for that group of people and how that might link to their health outcomes. What's interesting though is in the middle column, which I've highlighted in orange here, is that in Burnham-on-Sea there's actually fewer people who are long-term unemployed and fewer people who are students than the national average. So perhaps in that economically inactive group, there's probably more people who might be looking after family, might be more long-term sick, might be retired, and they might have more likely to have links with health outcomes. So it's just a way of exploring other data that might be able to tell us a bit more of a story around health outcomes and the data that's going on there for Burnham-on-Sea. I'm now going to move on to disability. So what we found is that 18.6% of people across Somerset have stated that they have a disability. So people were asked their day-to-day activities if they were limited by long-term physical or mental health condition or illnesses. And this was a definition of disabled person that meets the harmonised standard for measuring disability and is in line with the Equality Act of 2010. So the census for England and Wales in 2021, it was the first time that they phrased the question in the way that they have. Previously to that, in 2011, the census asked a question which was about problems related to old age. And that was kind of the old way of thinking and talking about disability, whereas now they are asking about physical or mental health conditions or illnesses that are lasting or expected to last 12 months or more. So therefore, this is the first time that the census for England and Wales has included mental health explicitly in its question about disability. So it's important to think about that when we're talking about some of the data that we'll be talking about in a minute. And it's also important to think about that when we think about the context of when the census was taken. It was in March 2021, and that was during the coronavirus pandemic, when we saw depression rates increase as well. So it's really important to think about that as a context for this question. So what we found in Somerset is that around a third of households have at least one person who has stated that they have a disability. 26% of those households have one person, 7% have two or more. So this is people who assess that their day-to-day activities are limited by a long-term physical or mental health condition. And it could be limited a lot or could be limited a little. What we've seen is in hybrid, 44% of households have at least one person that have stated that they have a disability. So that's the highest proportion across anywhere in Somerset. We also saw similar figures in Watchet, in Taunton, in some areas of Taunton as well. So it's just thinking about what's going on in those areas for those people. kind of moving on from that, we've seen that there is a bit of inequality across our county in terms of people who state that they have a disability. And it's in some ways similar to what we saw in the health outcomes. So this light blue line is those that have said that they are disabled and their day-to-day activities are limited a lot. So their day-to-day activities are limited quite a lot by their disability and what their disability is defined as. And then we've also got people who have stated that they've got a disability, but their day-to-day activities are limited a little. And it's about their perception about how much their day-to-day activities are limited by. But what you can see here is at the top, it's those with the fewest, with the lowest proportion of people who have stated that they've got a disability, and the bottom, the highest proportion who have stated that they've got a disability. And there's quite a big difference in the percentages there. So for Burnham-on-Sea, we're up to 26% of total number of people who state that they've got a disability, compared to about 15% for Bruton and Ilchester. So it's quite a big difference across the group. What we're seeing as well is we've got a huge overlap in areas where people state that they have a disability and appearing that they are in bad health or not very good health. As I said before, not everyone has kind of stated that they're in bad health, but these areas, these 4 areas, are those that stated that they had the highest rates of very good health, and they are also the areas that have stated that least likely to state that they have a disability. On the flip side, these 4 areas come up in those that have got the lowest health outcomes, but also the highest rates of people who claim that they have a disability. I'm sure this isn't that surprising, but it's interesting to note that these are kind of areas that are coming up both, and there is a huge link between what people perceive that they have a disability and what they perceive as their health. What we've also found is that there is a difference across males and females. Females are more likely to report that they have a disability than males, and that's both for disabilities that limit people's lives, day-to-day activities a lot, but also those that limit their day-to-day activities a little. We didn't find much difference across the different areas, so this is a common thread across all areas across Somerset, around males versus females. And what we can see here is that on the left-hand side, the male, female, that's for those who reported that they have a disability and it limits them a lot. So it's a lot lower than those that have reported that they have a disability and it limits them a little. But as you can see, it's slightly higher for females for limited a lot, and again, slightly higher for females for those that are limited a little. And as you can see, there's no real difference across the different regions. It's very similar across the different regions. So that kind of gender split does carry on throughout all of our regions, and it's not specific to one particular area or region of Somerset. We also have been able to look at those who've reported that they have a disability that limits their day-to-day activities a lot by different ages. So here it's every 5 years that you can look at, except for they're really young, which is under 1 and then 1 to 4. And the results show the overall population in Somerset is getting younger. We saw that across England and Wales, but we're also seeing this in Somerset. Usually what we would see with this graph is more of a triangle, I would say, but what we are seeing is that there is kind of a bit more of a curvature now in the early 20s, which is not something that we've seen that much in these types of graphs. And what's interesting to note here is that it's quite a small change, particularly for those with a disability that limits their day-to-day lives a lot. But this is really driven by females, particularly in Mendip and South Somerset, who have reported higher rates of disability that limits their life a lot. What we see is that this is even more extreme for those who've reported that they have a disability but limits their life a little. We often see that the percentages are higher for younger age groups in general when comparing to disability that limits you a lot. Younger people are more likely to report that they have a disability that limits their day-to-day activities a little rather than a lot. However, what is unusual is that this time is that again we're seeing higher proportions in their 20s, and this is particularly driven by mental health, and in particular females in Somerset. So for 20 to 24-year-olds, we've got 10%, and 25 to 29-year-olds, we've got 9%. But we see a high of up to 15% in females in Sedgemoor for that age group, and almost 13% in Somerset West and Taunton for that age group, for females as well, and that contrasts to males who are around 6 to 7%. So I think what's really important to note here is that this is the first time the census has been able to tell us a bit more about the story around mental health and the age groups that it's been affecting. And obviously, we have to put this in the context of COVID and everything that happened there and when the survey was taking place. But it's really interesting finding to come out of this data is that age group we are seeing some things going on around mental health, particularly in females. So thinking about what we might want to do and what we would need to focus on for that group of people. And now if we kind of look back at Burnham-on-Sea, we look at people who stated that they have a disability. We have a higher proportion in Burnham-on-Sea than the national average of England, so almost a quarter of people versus 17.3% in England. And again, it's thinking about putting that into context. So now that kind of adds to the data that we said around health. So fewer people than the national average are saying they've got very good health. We've got fewer people who are economically active. But we also have fewer people that are long-term unemployed and fewer full-time students. So it's thinking about what's going on for these people and how is it related to their health and well-being. Finally, I'm going to move on to unpaid care. So in the census, they asked, do you look after or give any help or support to anyone because they have long-term physical or mental health conditions or illnesses or problems related to old age? So the figures are relatively similar across all areas of Somerset with no major differences across different places. We saw around 10% of residents provide unpaid care, and 3% provide 50+ hours a week. So that's kind of full-time, very intense unpaid care. Quite high proportion provide around 19 hours or less of unpaid care, but we are seeing quite a chunk provide a very high proportion of their hours of their week for unpaid care. We are seeing that females provide a higher proportion of females provide unpaid care than males. Around 10 to 11% of females are unpaid carers versus 7.6% of males. Again, there's not that much difference across the different local authority areas. We saw the highest is in Sedgemoor, around 11%, and the lowest is in Mendip of 10.5%. So it really doesn't differ that much across the different areas. But we are seeing that it tends to be more females than males that take on that role. What's interesting here is about also the age of the unpaid carers, and this is a bit dissimilar to what we saw around disability. It's more of a diamond shape, so it tends to be those people in the kind of middle age groups that take on a lot of unpaid care, and so the highest proportion of people that take on unpaid care are aged between 55 and 65. And we've had a lot of discussions in our household about why that might be, and if it's around caring for a partner or if it might be around caring for your parents at that age, and thinking about how we can support these people, because it's a very high proportion of people at that age group that are taking on those responsibilities. I think what is also key is that there is disparity between males and females in that group, in that age group. So it tends to be around 20% of females between 55 and 65 that are taking on unpaid caring responsibilities, and it's around 12% for males. But there is quite a big difference between those who are male and female taking on that responsibility at that age group. And as you'd expect, as you get older, it falls quite dramatically again. So I'm finally just going to move on to thinking about how the data that I've presented relates to our work, and then I'll have a bit of time for a bit of discussion. I know some people have been putting some questions and thoughts in the chat that I've seen coming up. So we should have about 5 minutes for a discussion on that at the end. So the census helps us understand the context we're working in, and particularly for physical activity, thinking about comparing inactivity levels. It's really important to consider how all populations are different. And it also helps us to think about how we can focus on particular places that might have multiple inequalities that we would like to address. When we explored the latest Active Lives survey back in the autumn, we found some key findings around activity levels. So Sedgemoor was the least active area. Over a third of adults in the lowest socioeconomic group are inactive. And the kind of young adults who have always historically been the most active are no longer the most active age group. And what we found when we look at the population data is that we were thinking about what is it around Sedgemoor that might drive that? Is it the older population, more isolated, more deprived? Where are the lowest socioeconomic group people? Where do they live? And what might be going on in those places, which means it's more difficult to be active? And also, where are the majority of that young age group, and what level of deprivation do they face? And then when we kind of overlaid the employment and travel data, we were thinking about is there something in residents in Sedgemoor more likely to drive to work? What's driving that? Is it access to kind of major roads such as the M5? They're thinking about those in the lowest socioeconomic group. Are they more likely to be long-term unemployed? If not, what do they do for work? How does this affect their ability to be active? Where do young people work? How do they get there? Then when we looked at education and housing, we were thinking about how education links to physical activity. What about tenure and type of housing for those in the low socioeconomic group? What does it look like? And then thinking about housing as well for young people, and how that tenure and type of housing might affect their ability to be physically active. For example, living in flats, not having a garden, living in a house share. And then coming to today, thinking about health, disability and unpaid care. So how does the link between health and physical activity drive what's going on in Sedgemoor? What is it about health that might be interesting for us to explore in Sedgemoor? What health outcomes might be facing the lower socioeconomic groups, and what make it more difficult for them to be physically active? Are they more likely to be disabled or unpaid carers? Is it a time thing? They don't have time to be physically active. And how might, I think this one's really interesting, the kind of move from the 16 to 34-year-olds no longer being the most active group. How might that shift in people stating they've got a disability, particularly around mental health, for those in that age group that we showed earlier from in their 20s, affect this group's ability to be active? Is there something in that around people's mental health that's affecting their ability to be active, and that might link to why they're no longer the most active group? And then finally, as Somerset moves, we've got our 5 pillars plus our leadership pillar, and health and wellbeing really fits into that. With we've got a connecting with health and wellbeing strand, and this census data really gives us a grounding in what's going on across Somerset. And at the moment, it's very high level in terms of the statistics they've got, but they are bringing out more throughout the year, and ways that we can connect different statistics. So it'll be interesting to see what we can do and what we can explore in more detail as we move forward. And then finally, I think it's really important to remember that whilst here at SAS we're focusing on the physical activity sector, our strategy is system wide, and so other sectors are really important and have an impact on the people that we're working with. So those health services, particularly in the local environment, but also health policy at the national level, really impact on people's health outcomes. But also when we're thinking more closely at things like unpaid care, that those kinships and informal networks and the immediate family and the access that people have to people that can support them is really important as well. And thinking about how we can help people use those networks to become more physically active. I've now come to the end of the presentation, so what I will do is I will stop sharing my slides and I will take it to the floor and see if anyone's got any questions or any thoughts that they would like to share about what I've presented today. Lorraine, hi, nice to see you.
Hi Annabelle, hiya. I thought it was all really interesting actually, and it's great for me to kind of get that insight on Somerset too. What I thought was really interesting was a bit around mental health in young people. Kind of not surprising, but also some of our data that we've released on our surveys that have just been released, and they were very much talking about some of those new barriers that are existing for disabled people and non-disabled people. And one of those was the closure of facilities and clubs. And it's just a question around that really, because that's I think both indoor and outdoor. And just a question kind of around, as a county, I suppose the thoughts around that and kind of the added impact that that's going to have on that particular group, but also other groups that have got long-term health conditions or disabilities.
Yeah, thanks, Lorraine. That's a really interesting question. I think I don't know, Jake or Jane from SAS want to come in and comment on that.
You go, Jake.
Yeah, no, I think it's something that we're starting to see, and probably in the last 3 months. So we've seen a couple of instances within Somerset. So probably the most high profile one at the moment is the closure of Shepton Mallet Leisure Centre, which obviously was the only provision within that area. And obviously that has an impact on disabled people and all of the residents within that area. But obviously for disabled people, it has a bigger impact because of the travel implications to other facilities and things like that. So I think it's something that we're keeping a close eye on. We're supporting the leisure providers as much as we can by plugging them into other opportunities for funding to try and protect the kind of services that they provide. But it's obviously an ongoing issue across the country, and the energy crisis is really affecting them, especially those with pools. And we know the impact that swimming can particularly have on those people who are disabled. So I think that's probably our most interesting one at the moment, is protecting that swimming pool investment facility stock that we do have across the county.
I also think that there's obviously a piece about sports clubs shutting, but obviously what we're also seeing is volunteers, lessening volunteers, and it's interesting as Annabelle's talking about this bit in the middle, which are the early 20s. Actually, they're going to be the next lot of parents who actually come through and volunteer, and actually will have the resilience to do so when they have children and families, and so it's something about getting ready for some of that, because we only get a census every 10 years. So it's something about being ready, and actually what are our assumptions, or where are we going with that, and what other data can we bring to see whether some of our assumptions might be more likely to be correct, and therefore what are we doing to protect our future.
Thank you. I think that's a great answer as well. That kind of protecting and looking forward. So yeah, thank you.
Thanks, Lorraine. Tanya, hand up.
Hi, thank you. First of all, thank you, Annabelle. It's such an interesting set of slides and data that you've presented. I'm all for data in my role, but I think what this gives us is a tool as to where we can start digging deeper for some of those causes and how we can support people. A lot of the data, it gives you figures, but you've got to drill down, as we all know, that there are variable factors as to why people are less active and so on and so forth. But yeah, just to emphasize both what Lorraine, Jake, and I think everybody here feels is, sadly, austerity, lack of money, and COVID has had a huge impact on this latest set of data and on how people cope and their health and well-being. So, but thank you.
Jake, got your hand up?
Yeah, just an observation, really. I was particularly surprised by the high percentage, the 10% of carers, because ultimately, when you look at that across, nearly 500,000 population within Somerset, that is an incredible amount of people. And obviously, they don't have huge amounts of time to have their own, or time to have their own kind of physical activity, if you like. And I know that we've done some work with reminiscent learning, where we've done activity for both carers and the participants themselves. But I think we're only scratching the surface, and that's been funded through the Together Fund. And there's more details on that fund on our website, because I think, yeah, we've probably got lots to do in that area still. It's just an observation, really. I thought they was quite high numbers.
Going to throw in my observations as I go. So amongst many of us here on this call, we will probably do quite a lot of recruitment. And what we are seeing is a bulge of people who will come into being or should be economically active, who are suspected will not become economically active, or will be really difficult for us to support in our workplaces. And I think that it's something that exercises me in terms of, for all of us, and Lorna and I, through the Somerset Group of Charities, will talk quite a lot about recruitment and how hard it is. But actually, the pool which we're pulling from in Somerset, given that we already have quite a few less young people, might be a less resilient young people. And I'm just like, I suppose it's just amusing for me about, sorry, not amusing, it's a thinking about actually, the preventative work that we need to do. Otherwise, we are going to end up with a recruitment difficulties for a long time.
Thanks for that, Jane. Anne, you've got your hand up.
Thanks, Annabelle. Another really excellent webinar, really insightful and informative. Speaking of, considering the considerations of this 50 to 64 age group, they are what's classically known as the sandwich generation, and as you said, that they are predominantly women, or majority of them are women. So not only are they in the menopause phase, but they're more burdened with care responsibilities, as this data shows, and quite many of them will have children as well, so they'll have two generations to care for. and they'll be going through menopause. So and it's the economically inactive element of it is being picked up on by the DWP, and they are focused on trying to get this population back into work. Well, it's really important to look at their health needs as well. I think we need to think about that.
Yeah, thank you, Anne. I think that's a really important point, that there's a lot going on for that age group, and as you said, it's not just that they might be caring for their partners or their parents, but also they've often got children as well. So it's a lot. A lot. I'm just laughing at Jane's comment in the group. I can see Jake typing. I'm not sure what he's going to respond to that. Jane, you're on mute.
Said I was going to call out Jake as one of the, as Matthew left the call, I thought, oh, I'm going to call out Jake, but as the only man on the call, but I thought that would be mean.
Well, I was going to try and beat you to it, but now you've done it already. What I was just about to type was I think the coastal community bit is again interesting. We've obviously seen that come up in the conversations that we've had with Active Humber as well, because they've got similar issues, and it's come up through this data set. We've seen it come up through Active Lives as well, so it's not something that's obviously going away, and I think the people in those coastal communities have challenges around work, and I think especially within Burnham, we know is a really difficult area, but also Minehead, in terms of that it's quite locked, it's quite, you've obviously got Exmoor on the other side and all surrounding it. So yeah, I think it would be good to explore some of those some of the Burnham and the Minehead communities with the other data sets that we've got available.
Yeah, thank you, Jake. Before we finish, does anyone else have any thoughts or comments? Just to let you know that the slides and the recording will be shared, and it will be put on our website, so you can also share it with other colleagues or people that you think might be interested in it. So please feel free to share widely. But yeah, if anyone's got any other thoughts or comments before we finish, then please feel free to share.
You still got your hand up, Anne?
Yeah, just a point actually, because obviously, again, on the gender-based differences, thinking about encouraging activity and thinking about how that activity, because at different stages of people's lives, different, as you know, different types of activity, and the traditional ways of getting middle-aged women to increase physical activity have been shown now not to be effective in terms of weight reduction and things like that, because they're linked to cortisol. And it's really, really important that people understand that. So obviously you guys are the experts, so it might be worth thinking about that as well, about finding different ways of getting women of that age physically active, and that involves reducing stress.
Thank you, Anne. Yeah, I think that's a really good point. So thank you everyone for joining, and I hope you found that useful. As I said, I'll share slides and a link to the recording, and hope you have a good afternoon. If you have any more questions or thoughts, then please do feel free to email me. More than happy to have a chat further. Thanks everyone.
Thanks, Annabelle.
Thanks, Annabelle.
Bye.